Hey guys, welcome back to my channel. My name is Mariah and here on my channel I post lifestyle, university and physiotherapy related content. So if you're interested in that, make sure to subscribe and turn the notification bell to all so you never miss a video. As you can tell from the title, I want to talk about how to gain work experience, specifically for just healthcare students. But gaining work experience in general, you can also use these tips. So if you don't already know, I'm a MSc Physiotherapy student. Sorry for the shaking, I've got the camera balanced on the bed, so you might shake a little bit. But yeah, so I thought, considering that the summer break's coming up and if you want to go into a healthcare setting, they will typically require you to have some work experience, and the work experience will also help you to gain a better understanding of the field that you're going into, so you can actually be sure that it's a path that you want to go down, rather than, you know, getting onto the course and then being like, I don't actually want to be here. So I've just made some notes in my little YouTube notebook. And so the first question I want to address, well, the main question I want to address, is how to go about it. But actually, I think before that, it'll probably be helpful to hear what work experience I gained within the healthcare setting, or that's like related to, that basically relatable, that I could use the skills. So most of my work experience wasn't healthcare related typically, but it wasn't like physio specific. So that's one thing I have to say, that it doesn't have to be like, oh, because I want to be a doctor, I have to go shadow a doctor. Like, no, it's helpful obviously, but if you're not able to get that kind of experience, it's okay. Like, you can get transferable skills, like you can get other experiences which will give you transferable skills, and that's kind of the approach I took. I had physiotherapy work experience, and that was literally only 2 days, and I shadowed physiotherapists, and that was like at the end of secondary school, so that's years ago. And then, like, because obviously now I'm in my first year of my master's, so many years ago. But after that, I made sure I did other experiences, such as like volunteering for St. John's, so healthcare-ish, like healthcare, doing a first aider for St. John's when I studied abroad, doing experience being a mentor, when it came to shadowing an athletic trainer, stuff like that, getting a job, like working your general job, like working with the general public, even if it's like scooping ice cream, which I did, or working in a hostel, which I'm doing now. Like, those things give you skills. They teach you how to work with different populations, they teach you how to communicate to different populations, it shows that you're organized, etc. These are all transferable skills that you can explain to somebody, whether in your interview for uni, or just justify whether you have those skills that the profession is looking for. And I think that's a good thing to, like, good way to think about it. So don't think, oh, because I'm just doing a newspaper round, for example, I don't know if people still do that, but like, oh, I'm just doing that, is that going to be relatable experience? It may not be directly relatable, but you have skills, like, you know what I mean, like, you do things in a timely fashion. That's an important skill. As long as you can do what I'm basically just doing, is justifying why an experience is relevant, then you'll be fine. Like, don't mention something on, like, let's say a personal statement, don't mention something if it's not relatable. Anyway, I kind of went off track. But how to go about getting it? So I've got written down here that, like, you can go NHS route, and that's the route that most people tend to want to go for, but I understand it's obviously really hard to get NHS work experience if you don't have connections in the area already. So, because it's like, you need connections, but not only do you need connections, you need to, most boroughs only take people from the local borough, whether that means, like, even if you volunteer to sit down for like an hour a week and read with patients, that's still experience, you know, because at that time you could be sitting there reading, you can monitor like what a person's doing, you can be like, oh, I saw the nurse do this, and then read up about it later, or I witnessed that, you know what I mean, like skills like that. I've also got down charities, volunteering, and transferable skills. I already touched on the volunteering and transferable skills, but continuing with the NHS, like little things in terms of being like, okay, I know my local hospital, when I wanted to look for like some actual NHS experience, after obviously it'd been many years since I did my secondary school experience, I was like, okay, let me see what my local hospital's doing, and they had that volunteer thing where you go in and read with patients. The only thing is, you need to have a year's commitment, and I knew I wouldn't be able to commit to that. But look into things like that. And I know people, like, for example, if you want to go into physiotherapy, your main thing is like, okay, let me start sending out emails to local clinics or whatever, and you don't always get a response, so it's a little disheartening when you don't get a response. But there are other ways to gain that work experience, or to gain some form of experience that you could justify. And I know that when I got into this degree, they understood that because I was applying during a pandemic, people may not have a recent experience, but they wanted you to understand what you were getting yourself into. And that's like something that's obviously very big about it. But you have things like, for example, Future Frontline. So Future Frontline is it's like a charity thing on Instagram. I'll have to link it, but like I did a blog post with them once, and they're very good. They hold talks like is it weekly or monthly talks? Basically they hold regular talks for healthcare professions, and you can hear like how an MD team would be working on a condition, etc. I'm probably butchering the description of Future Frontline, but check them out honestly. But yeah, like stuff like that, that's helpful because sitting in those talks, and I sit in talks for my CPD folder to show that I'm like continuously developing, etc. But like talks like that you can get a better understanding. Like I have a talk tomorrow looking at like pediatrics and respiratory. I may not cover that in uni. I'm probably not going to cover that in uni to the amount of depth that this hospital is going to give me just based on that talk. And from that talk, I could go to an interview and be like, I may not have the hands-on experience, but I sat in a talk run by physiotherapy, like qualified physiotherapists that mentioned that you go about these procedures, and I read up about this, etc., etc. So like that can still in itself be classed as work experience. Reading, like attending webinars, and you get like a certificate at the end anyway for attending those things. So that's really helpful. I've also got like when it comes to volunteering, don't just think about clinics in terms of, I know going out more like the physio route, but like don't just think about clinics and GPs. You could also think about like hospices. It really obviously depends because like hospice is you're obviously aware of the setting you're going to be getting into. So if you're a very emotional person, I'm not saying that you have to be detached, but like, you know, just be mindful of stuff like that. And you can even volunteer maybe in schools. Obviously schools are slightly harder because DBS checks and everything, but like when I had to do my service learning, I was going to volunteer for this I can see the pattern of the charity in my head right now, but it wasn't like the Red Cross. It's like a it's gonna beat me up. No, I can see the website in my head right now, but I just can't see the logo. But they hold weekly games, like play groups for kids with disabilities, and then I was going to volunteer for that, and like that alone shows that you could work with a different population. You know what I mean? Like that's kind of experience that you can show and help yourself in terms of work experience. And I understand obviously in the summer break you're not going to be able to do that necessarily in terms of like schools, etc., but those play groups would be running during the summer, maybe even more than they would during the term. So that's something to consider. Just reaching out quite a bit, reaching out, looking at stuff online, maybe doing some reading, explaining how this experience has helped you with other experiences is really important. So before I continue to ramble on, I will just wrap that up there about work experiences and how to get them. So my main takeaway points will be whatever experiences you do, whether it's working a part-time job, whether it's actually work experience within your field, as long as you get the transferable skills and you can justify what you learned from it and how it's relatable to the path you are trying to go down, you'll be fine. Honestly, you'll be perfectly fine. And as long as you have obviously the other skills, you'll be fine and they will love it. And use the connections you have, whether it is reaching out to people on LinkedIn, being like, that's a great thing, is there a possible way I can get involved in that? Or whether it's attending like talks. For physiotherapy is the CSP. They have like a CSP, this the organisation, the body, physiotherapy body, and they do webinars. I mean, I have a membership, but like they do webinars, whereas like things like Future Frontline, you don't have to have a membership to attend these. You just get a little ticket off Eventbrite. Yeah, I think it's Eventbrite. Yeah, I should know by now. I'm quite on it quite a bit. But like stuff like Eventbrite, webinars all the time. They're usually free. Jump on it. Just connect. Honestly, just message people. Be like, hey, I saw you doing this. Work experience. I have really rambled, and this business is probably really all over the place, and you're probably like, so how do I get work experience? But hopefully you're not, and hopefully I helped you out a little bit. But yeah, I'll speak to you guys in the next video, and good luck getting that work experience and becoming the healthcare professional that you wish to be. Bye guys!